Reliably estimating autism and learning disability prevalence in prisons is essential for making judicious allocation of resources. In this review, we found that prisoners with learning disabilities and autistic prisoners are actually overrepresented within the prison population.
This review came off the back of the NHS report into meeting the needs of autistic adults and people with learning disabilities in prisons, and they commissioned us specifically to review what was happening in prisons across the Midlands.
The Autism Research Innovation Centre at the University of Lincoln conducted this review in 24 of the 26 prisons in the Midlands. 93 prisoners, 175 prison staff and 16 staff from pre- and post-prison services took part via a range of methodologies, including data reporting, questionnaires, focus groups, and interviews.
The aims of our review were to conduct an independent evaluation to find out what is happening in practice to support people who are autistic or with learning disabilities.
We had 15 different questions to answer that were set to us by the NHS. We needed to identify areas of good practice within services and also what was missing.
We really felt for this evaluation that we needed to speak to the people with lived experience to find out how it was being received, because what you can find is that the staff members will tell you what's happening, what the policies say, what the services are, but sometimes it might not be experienced in the way that is intended.
We use a holistic approach by asking both staff and prisoners about their needs and perceptions of what works well, what doesn't work well, what can be done to improve.
Of the 24 prisons involved in the research, 15 were visited in order to get a clearer picture of the lived experiences of prisoners.
Whilst we saw examples of good practices with specific prisons, at the same time it was clear that these were not present across all prisons. We made recommendations based on what prisoners and staff told us in an attempt to create a model that can be implemented universally.
The ARIC report makes a number of recommendations for each of the 15 questions the review set to answer. These can be summarised under the themes of care pathways, training, information sharing, and resources. The review highlighted the need for consistent screening and assessment for prisoners as soon after entry to prison as possible, a clear support plan tailored to their specific needs, and the provision of reasonable adjustments where appropriate.
Screening is so vital because it allows people to then access the support. What's needed is the guidance around when it should be done, what tools should be used, and how that information is then used to help that person and to follow them through as well, the system. We saw loads of issues with this, people saying that it's just not accessible, and they were being told to wait until they left prison to get the screening and assessment done in the community.
So we spoke to a number of prisoners who did have a diagnosis. They told us that although they'd found the assessment quite difficult, actually it helped them to make sense of themselves, but then they didn't really understand what that meant for them. And it hadn't really changed the support that they were receiving.
There needs to be formal support in place that can then be documented on a care pathway.
Training was a key theme throughout the results of the staff survey. Prison staff reported a lack of confidence, knowledge and understanding required to best support autistic prisoners and prisoners with a learning disability.
Consistently throughout the study, what the staff were saying, needing more training, more systems, more knowledge, was in line with what the prisoners were saying. I need people to help me more, I need people to be seeing me in this way better.
It seemed that most people did not have the opportunity to actually gain some formal training for autism and learning disability. And we heard many examples of people self-learning or by referring to their own lived experiences.
So whether it was a family member who was autistic or had learning disabilities, they seemed to be able to relate more to the prisoners, which meant that they were able to tailor their communication or to support them and work with them in a different way that really suited their needs.
Information sharing is key to providing continuity of care. As someone enters into the justice system, it is vital that any information that is related to their past experiences medical history, or any diagnoses they may have travels with them into prison, as well as between prisons and healthcare providers, ensuring that they receive the support required. This is a challenge due to confidentiality legislation. However, information sharing is possible within a prison context.
We found evidence of good and bad practices, and we can use good practices to create a model that could be used across all prisons.
To give an example of when information sharing didn't happen, a person that we spoke to said that every time he went to a different prison, he got given a different diagnosis. And he said, it makes me feel like 3 different people. In another example, we spoke to somebody who had been in receipt of counselling before he came in prison. But when he arrived in prison, nobody would speak to the counsellor, nobody would gather the information about what he needed. And he felt like that was a huge gap in terms of the prison being able to best support him.
All the recommendations are underpinned by a lack of resources to deliver the support needed. This could include anything from necessary finances, access to screening tools, and training or equipment to provide reasonable adjustments, such as easy-read overlays for documents and items to address light and sound sensitivities.
And we saw that in the staff responses. They were telling us that they wanted to do work, that they were coming up with local initiatives to help manage the need of their particular population, but they were really struggling because they didn't have the resources to do that.
It's really about shaping up good practice. If you do this, people are less likely to get in trouble in the future, less likely to reoffend, less likely to cause harm in the future. That ultimately is the best interest of the system. So it is a win-win, but it does require an investment in the first instance.
Despite the issue of the need to improve services being much bigger than anticipated, we did hear some stories of good practice, positive outcomes, and successes.
A good example was from somebody who'd come in who had not got a diagnosis but had issues with their behaviours. When he came into prison, he was able to get the screening for autism, and he described this as being quite a positive process for him, not just because of the screening being done, but because of the support that was put in place around that. People were able to consider what his needs were, and this was taken into account, which meant that there was less confrontation then. So it enabled him to work through his behaviours, and he feels that that has been a really positive experience for him.
The conversations that we had highlighted a real willingness and eagerness to improve the awareness, understanding and support available.
Not only was there a will, but also it was consistent across all the members of staff. So whether or not you worked for the public sector or private sector or health services or prison service, everybody saw the problems the same way. Everybody saw their solutions the same way.
I believe that commissioners are very keen to drive change. I hope that the information we provided will help them guide the implementation of changes.
We've been able to access such a wide range of data from such big numbers of people. That in itself is probably one of the biggest pieces of work within this particular area that has taken place. This provides a real opportunity to be able to use what we found and to be able to make these recommendations that leads to better outcomes for autistic people in prison and people with learning disabilities in prison.